My research is an Alzheimer disease. I'm in the Department of Translational Science and Molecular Medicine in Grand Rapids. And when we talk about aging, we are thinking about Alzheimer disease. And that is actually not surprising because we have epidemic of Alzheimer disease right now. There are more than 5 million people in the United States affected by the disease, and it's already the sixth cause of death in the United States. And every 67 seconds, there is one person diagnosed with Alzheimer's disease. So the economical aspect of it at the public stage and also at the personal level is astronomical. So that is very worrisome for everyone. And actually, data from the Alzheimer Association indicates that you go out there and ask anyone that is 65 years or older which diseases they are afraid the most. In that list, there's going to be Alzheimer's disease right in the top. And the reason is because at this moment we are confronting huge challenges in terms of the diagnosis and the treatment of Alzheimer's disease. In terms of diagnostic tools, we don't have right now a specific marker that tells us that the person has Alzheimer's disease. We have probable or possible diagnostic of Alzheimer's disease. So a colleague and I, Scott Count and I, were working on finding biomarkers early on before symptoms take place. Actually, going back to what I was mentioning in terms of how people are worried about Alzheimer's disease, the data indicates that if you're worried at 65 years old, that's too late. The disease, the pathological process started up to 30 years before clinical presentation. So we have to face this challenge and develop diagnostic tools before clinical presentation takes place. So we're looking at blood samples, serum, plasma. We're looking at CSF, cerebrospinal fluid, and we are actually interested also in understanding why specific brain regions are vulnerable to the disease where others in the same individual are completely spared. So what we can learn from those brain regions that are completely spared is very important. The other aspect that I mentioned as a challenge is the diagnostic. And we don't have right now any therapeutic agent that stop, reverse, or prevent the disease. And with Nick Kanan in our department, and we are actually engaging in immunotherapy using antibodies that he has developed and use the transgenic animals that I have that mimics the neurodegeneration so that we can see whether those antibodies can help clear the pathological hallmarks that are present in Alzheimer's patients. And also I'm collaborating with people in the chemistry department here in East Lansing that develop drugs that can help the degradation machinery that the cells have to then try to activate those machinery and then able to clear those pathological molecules. And there are experiments ongoing as we speak. But there is one more challenge that we're facing in Alzheimer's disease research, and it's research bias. We have suffered from it for the past 20 years, the past 2 decades, and it was very dogmatic field where A beta and tau were the only thing we have to look at. And since the last 5 years, we started looking at other aspects: neuroinflammation, immune response, different molecular markers that can help us better understand the disease. And one bias that we can integrate, or has been integrated in our research design, is ethnicity. African Americans and Latinos have been shown to have a higher incidence of Alzheimer's disease. However, I say, well, if the Latinos, I was in the University of Puerto Rico for 9 years, I say if the Latinos have a more aggressive Alzheimer's disease and earlier age of onset, well, let me look at the Puerto Rico population. And what I found was that the age of onset in Puerto Rico was similar to the Caucasians in the United States. So the aspect here that we have to look at is the socioeconomics. Even in Puerto Rico, if we compare a lower socioeconomic status versus high socioeconomic status, the lower socioeconomic status has an earlier age of onset. And we have to look at those cofactors that are migrating with ethnicity rather than pointed out that if you are a specific ethnicity, you have more chance to develop Alzheimer's disease. But more importantly, and I have two seconds, is the concept that we don't have to wait for finding a molecule to diagnose and a molecule to cure. We have already knowledge that we can pass to the general population to reduce our risk of developing Alzheimer's disease from better health, living, sleeping better, reducing stress. So I believe that we should move from the bench to society instead to the bedside. If we hope for the bedside, it's too late. We should move from the bench to society. Thank you.